Hi, and welcome, Sandra and Sunita. Today, we are going to be doing a lupus awareness discussion. This is not legal or medical advice. We are just going to get the experience of lupus advocate and a member of Lupus Ontario. So the aim of this discussion is to give us an insight on what is lupus, what are the resources out there, how we can manage the situation, and who we should contact or who we should direct our questions to if we have more questions. This session is being recorded, and the aim of this recording is basically to give Lupus Ontario access to data that they can use on their platform. So I'm going to start away with Sandra. Please introduce yourself to us. Yeah.
Hi, good evening, everyone. My name is Sandra Williams-Reid, and I'm one of the board of directors with Lupus Ontario. I joined the board in 2020, and I have been a member of Lupus Ontario for a number of years. I have lupus. I was diagnosed over 30 years ago, and that's it for now.
Okay. Same thing to Sunita. Please give us an introduction.
Hi, my name is Sunita Mandi. Just an advocate for lupus, and I was diagnosed with lupus. It's been almost 13 years now, but been sick for about 4 years before then. So in total, about 17 years dealing with lupus, and I'm looking forward to discussing exactly how I manage my lupus.
Okay, thank you very much for that introduction. I have to be honest here, I didn't know that both parties on the panel actually, I thought one is actually just an expert and the other is somebody who is going through. So I think it's a pleasure for me to, or maybe this is the first time for me to actually have a conversation with two people who have lupus. But before we go ahead, and Sandra, you might answer this, and Sunita, you might add more information if you have. What is lupus, and how do you get to know about the disease?
Well, lupus is an autoimmune condition, and what that means basically, in a normal person, for example, your immune system is your protector. So for example, when you get infections, etc., I'm sort of making it in a simple term. When you get infections, for example, your immune system will defend you and help to protect you against infections. With lupus, the immune system, you develop inflammation throughout your bodies. And what happens is, instead of the immune system recognizing that you maybe, have infection, for example, the body internalizes and it turns on itself. And what we say in lupus terms is the body attacks itself. So it can't recognize that this is not a foreign invasion that's entering your body. So that's a small, but if you want a more direct view, I'm going to read what is in the Lupus Ontario booklet, just to give you a full definition. So lupus is a chronic disease characterized by inflammation in one or more parts of the body. It belongs to a family of autoimmune diseases that include rheumatoid arthritis, MS, juvenile diabetes, and scleroderma. The most common type of lupus is systemic lupus erythematosus. Short form is SLE for that. And it's a complex and battling condition that can target any organ in the body. And I think you're going to get back to this later. So this will kind of answer some of the question off the top. And also lupus, there's different kinds of lupus. So I, for example, has SLE, which is the systemic lupus. There's another kind, discord lupus, which affects mainly the skin. And there's also a drug-induced lupus, which is usually caused by medication. But once you stop taking those medication, it usually will get better. So hopefully that will help. Sunita, would you like to add anything?
Yes, I think Sandra is right. I usually explain what lupus is in a layman term, where I'll say when you have a cold on a normal person, usually your immune system, your natural immune system will fight that cold. But with lupus, what happens is that cold, your immune system will accept it. So it doesn't recognize bad or good. Your immune system will accept it, and your immune system is supposed to fight that cold, but instead with lupus, it accepts it, and now you have to find a way or take medications in order for your immune system to recognize, okay, you need to fight that cold. So that's what lupus is. And same as Sandra, I also have the SLE lupus, which with mine, it affects my blood work. It affects right now, the rest of my system is okay. It's just my blood work that it affects everything, the red blood cells, white blood cells, and hemoglobin as well.
Okay. I appreciate you trying to tell us the layman terms, but a lot of people don't know about lupus, and I'll plead with you to forgive our ignorance or look over our ignorance. Is for educational purposes, is lupus like contagious, or how do people get it?
Okay, lupus is not contagious. You cannot pass it on to anyone else. Right now with lupus, when I was, for example, diagnosed, I just got sick, and that's what happened a lot of times. It's like that the symptoms of lupus could be hidden for a number of years, but something environmental or otherwise might trigger it. Stress is a huge trigger. So there's different things that might trigger it. So that you will, so for example, the first 23 years of my life I was not diagnosed with lupus. So basically, it's not something that's hereditary as far as research goes now. We do not know what caused lupus. So unfortunately, I cannot tell you how you get lupus, because on all the research they've done, we still don't know what really causes. We know that what sometimes triggers it, it's environmental, some cases, it might be genetic based in some cases, but we really don't know what causes lupus, and we don't have a cure for lupus at this time. So in answering those two questions, what is lupus and how do you get it? So again, like I said, different things can trigger it. It's not hereditary, like for example, the disease that affects a lot of Black people. What is that disease, Sunita? I can't think of it right now. Sickle cell, exactly. Sickle cell, so yes. It's not, I'm using something that our audience can relate to. So it is not like sickle cell that you could inherit from one or both of your parents in some cases. So, and unfortunately, because we don't know what causes it, we know inflammation is created in the body. We know that lupus can cause organ damage because it can affect your organs. Those are some of the things, but because we don't really know what caused it, to say how you get lupus, I can't really answer that question properly.
Anything to add, Sunita?
Yes, I think Sandra is right, because there's no way, like with the research that they are doing, that's why lupus is a disease of many faces, because everybody's lupus is different, and we don't know if it's genetics, we don't know if it's environmental, but stress is the #1 factor that, of course, will bring up any disease. So with my story is, of course, I'm thinking it was both combination of environmental and stress that brought it up. But like Sandra said, because we don't know what causes lupus, there's research still being done. And also right now, very difficult to find a cure, because every single person's lupus is different.
Okay.
Yeah.
Go ahead.
Sorry, I just want to add,
Sandra,
just to follow up what Sunita said. Yeah, lupus is known with the diseases of 1,000 faces because it mimics so many other diseases. So for example, arthritis is a big part of lupus. So you might start with just joint pains, for example, and it might appear that you have lupus. So through blood work, maybe get into diagnosis of lupus, maybe will help. So once you start experiencing certain symptoms, for example, if you're or kidneys are involved and you start having kidney, a lot of those tests will show up on your blood work. So once you start, the symptoms start manifest themselves. You're going to go to your doctor, and hopefully you'll have a good doctor who maybe recognize some of the things. Lupus has come a long way from when I was diagnosed with lupus. A lot of research has been going on. More doctors are becoming aware of lupus, and something like what you're doing tonight is bringing awareness. Lupus Ontario is constantly working on bringing awareness. So through awareness, more is being learned, more is being done. So you don't know, you can't really say how you get it, but once symptoms start manifest themselves and you go to the doctor, they will start doing blood work and a number of tests. And through those tests, there are certain markers that they can use to diagnose the lupus. So I could say, once the symptoms are manifested, then you can get diagnosed, but you also have to have certain criteria to be diagnosed with lupus as well. Hopefully that helps a bit.
Yeah, okay, we'll get later to discuss about the stress and environmental factors, but let's take a step back. How serious should we take lupus? How serious is it? Like, if your experiences, how, when you go to the hospital, they say you should rate your pain from 1 to 10. How serious are you going to rate lupus from 1 to 10? Sunita, so let me go with you.
When somebody asks me in the morning, how are you feeling? The normal answer is usually, I'm good, I'm feeling okay. But it's always a 10, a 9, an 8. For a normal person, that would be like, oh my goodness. But because of the pain that your body becomes accustomed to, it's more like you're immune to the pain. So just like what Sandra was saying about rheumatoid arthritis, that's exactly how your body reacts. Some days you get up feeling okay, some days it's really bad, but if it's strong enough, you still have to push through to make sure you're okay. So if you ask me, how is the pain? I'm always in pain, but on the bad days, it's like 11, 12, and those are the days that I say, okay, I need to stop and stay home. But on a normal day for me, it's always about 7, 8. So that's a level. I don't know about Sandra.
Okay, so should you take lupus serious? Extremely, extremely serious. Because if any of your organs are affected by lupus, you could end up with, needing a kidney transplant. So it's very serious. It's not a disease that can be taken lightly. So I'm just going to use your perspective of 1 to 10. Yeah, because it maybe not be as well known. People might not think it's as serious as some of the other diseases out there that are more well known. But lupus is extremely, extremely serious. It should be taken serious at all times. Everyone is affected by lupus differently. So the way my lupus affects me and the way it affects Sunita is different. There is no one treatment for lupus, again, because of how it mimics itself. There's, like I said earlier, it's the disease of 1,000 faces. So you might think you have the flu, but that could be a lupus symptom. And if left unattended, because you think you might just have the flu, that could become very serious and you could end up in the hospital. So something as minor as that, because some of the symptoms of lupus are flu-like symptoms. But by all means, it should be taken very serious. I would say, as in any other category, I would say it should still be taken serious as a 10. So if I walk into the emerge and I said I'm in pain, and they said level of pain 7 to 10, but with lupus, some mornings you get up and you can't even move. You can't get out of bed. Other mornings you get up and you're great. And again, when we get into talking about the stigmatization of lupus, that is one of the way, because one day you could be perfectly fine. You're going about doing your business, everything. And the next day you could be literally cannot get out of bed, flat on your back. So I'm just using that so you could know from one extreme to the other. And with lupus later on, depending on your question, we'll talk a little bit about the phases of lupus, the flares, the remission, etc.
Yeah. So, you brought up sickle cell. Like in sickle cell, it's usually the joints that are paining, sometimes the muscles. In lupus, what part of your body pains and how is it? Is it like a cramp? Is it like a stabbing pain? Sunita.
It's an whole body pain. It's more like I'll use myself today. Today I got up, I was limping, right? So as the day goes by with the medications I take, I start to feel a little bit better. But then the fatigue kicks in, and then you slow down again. So it's not like, it's a combination of every single pain that you can think of. There's a pinching, you have people with lupus who also have, so it's just a combination of every single pain. Is it, I don't even know which other pain, but it's a combination of everything. And like Sandra said, everybody's pain might be different, and depending on what time of the day, or depending on how that person's day is going as well.
Okay.
Okay. I will follow up with that. For example, again, we're using ourselves as examples. With mine, I have osteoarthritis is a big part of my lupus. There's days I get up, my joints in my hands might be hurting, so I can't maybe lift up a cup as easily as I'm maybe able to do. Getting up and down the stairs, my knees are is in pain. A lot of people with lupus, because of the pain and stuff, end up at a very young age, like myself, having to have like knee replacement and hip replacement. There's, teenagers, because of the nature of the disease. So again, going back to how do you rate lupus, it's very serious. And the pain is intense at times, other times not as intense. But when you're in pain, you are certainly in pain. And it becomes, in some cases, there are people who are living with lupus who are totally debilitated because of, the formations, their hands and stuff, and that's caused by the disease.
Let me just stay with you. So before you were diagnosed, you were going through this pain. What was your family thinking, or your friends and those around you, or yourself? What were you thinking was going on?
Well, my diagnosis was unlike some other people, and including, members, people that I know. With my lupus, mine started. Some people they might start with inflammation around the heart, where it's sudden, it's immediate. A lot of people get what we call this butterfly rash on our faces. So there are some symptoms that you can recognize right away, and you can walk into a doctor's office and they could look at you even before a full blood work can tell you, these are some of the symptoms of lupus. With mine, when I wasn't really sick when I started my lupus journey. It took 2 years for me to diagnose, but I wasn't one of these people who ended up in Emerge. My daughter also had lupus, and she ended up in Emerge, she had pericarditis of her heart, which, is very serious, in 24 hours having to have surgery. With mine, I had an inflamed lymph node, which at the time I didn't really know what that was. All I know was there was a pain underneath my arms. It wasn't going away. I went in to see my doctor because I thought maybe I'd pulled a muscle or something. And that's how my journey started. I wasn't sick. I wasn't even in really bad pain. It's just that it was persistent. I later found out what had happened is not just the lymph node underneath my arms was inflamed. And again, it goes back to what I talked about, inflammation in the body. When I gave that concise description of lupus, was all my lymph nodes throughout my body was inflamed. So of course, the first thing they think of, I was sent to see a specialist, which happened to be a surgeon, because the first thing my doctors, when they realized what was going on, they thought maybe I had cancer. And of course, I ended up right away getting biopsies done, and I had a number of biopsies done. Thank God they kept coming back, you know, benign, benign, benign. But I had good doctors who they knew something was wrong because it wasn't normal to have all your lymph nodes enlarged and inflamed. And like I said, I went on a 2-year journey before I was diagnosed, going through specialist hospitals, nuclear like everything. So that sort of gives you an idea. But like I said, I wasn't sick. I wasn't experiencing anything, just that inflamed lymph nodes. So, Sunita?
Yes, so Sunita, tell us your own journey. What did your family and friends think of when you're telling them, oh, I have this pain, and every day you come back and say, I have this pain? Were some of them like, oh, you might just be making a joke, or you're not serious?
Yeah. Absolutely. I think with my journey is a little bit different from Sandra's, in the sense that I grew up in Africa, and usually when you're sick, the diagnosis is usually malaria, or, they give you malaria medications, and which helps. But then I used to be like, I thought about this once I was diagnosed, going back to see what was going on. I was always a sick kid. I was always a kid who would never go outside to play under the sun, because, I'll end up with headaches or things like that. But before I got diagnosed, I was actually sick for about 4 years, and it was in and out from the hospitals, always in pain, headaches, migraines, joint pain, again, back and forth with all the tests, thinking it was malaria. Then until 4 years after that, I think there was once where I was in the hospital for about few weeks. I can't, even till today, I can't remember what exactly happened in the hospital. But yeah, during that time, I mean, my family, usually nobody really knows what lupus is, right? So till today, I still have to explain. Usually I explain just what the symptoms are like when I'm really on a flare up. But the people who were really close to me, like my mom and some few friends were the ones, and some cousins were the ones who actually took it serious, because they understood they saw me go through that pain, because I was really in pain. I couldn't move. Finally, I was diagnosed after being in the hospital for I think 2 weeks. I remember my mom said, we are not going home until somebody tells me what's wrong with my daughter. That's exactly what happened. And we stayed in the hospital, they ran some tests, and a new doctor came in, and she was the one who actually diagnosed me while still in the hospital. And then she was able to change some few medications, and I started feeling better. I have to say, till today, she's the only rheumatologist I still see. But as time went by, I think my family and some friends start to come around to understand exactly what lupus is, especially when they see me. But I know sometimes with me and my posting on social media, they're like, oh, are you sure? I have to explain, listen, you have the good days, and you just have to push through and just do your best to do what you can do. But I think right now, most of my family and friends, they are coming around, but of course, it's still a struggle. And like Sandra said, we're going to talk about the stigmatization of lupus later, which is one thing that we are all struggling with.
Yeah, okay, I'm learning a lot, and I'm just checking the time, and we've almost used half of the time already, because I'm trying to keep this under an hour, and I've not even gone anywhere. So I'll try to move ahead. I wanted to talk more about diagnosis in countries where you have mostly people of African heritage, but I think if we have time, we'll talk about that towards the end, so that we focus here. Now, there are some people listening here, and they are hearing about lupus for the first time, and they might have a relative that has, or a friend that has the conditions that some of you have described. If they are going to their doctor, because I believe there might be some doctors who really don't even know about recognizing these, let alone doing a test. What are some of the information, or what are some of the things that they should tell their GP so that they get tested for lupus?
What I would say is before they go in, they do a complete history, like go back as far as they can remember, make a list of what's been happening. Like Sunita said, it happened over a number of years. With me, it took a 2-year journey before I was diagnosed. So what I would say is before they go to see the doctor, they make a list of all the symptoms and what they've been experiencing. That way, when they get to the doctor's office, they can give them that list. And that's just for lupus, that's just for anything in general. If you're not feeling well, it's always good to record what's been going on, say maybe in the last 3 to 6 months, how you're being affected. And it will give the doctor a general idea, maybe just where to start, like in any other case. And that's what I would suggest if before they go in to see the doctor. What can you tell them? Going back to, do you know that you really have lupus? It's not something you're gonna walk into a doctor's office and say, I have lupus. It's not like where you've done your tests and there's maybe a lump in your breast or something. I'm using that as an example. And you could go into the doctor and you could say, I have a lump in my breast. I want to be tested for cancer. That's not the case in lupus. Nobody really goes in and say, I think I have lupus. But what has been happening now is because of awareness, because of organization like Lupus Ontario, people are recognizing, people are starting to read the internet. They go and they'll Google some of these symptoms and it might trace it back to lupus. So yeah, maybe when you go in, you could say, I think I might have lupus based on these symptoms, but again, you should have a recorded copy of what those symptoms are.
Yeah, absolutely. It's a combination of everything, like Sandra said. I remember with mine, they asked me a lot of questions in regards to my pain, like where was the pain coming from? And again, with the malaria questions and yeah, so it's just a combination of everything. And also there's the one test that they run. And again, it takes a doctor who is very familiar with lupus to be able to ask you those questions and do that specific test. I'm trying to think of the thing right now.
The anti-raw DNA, or which one are you thinking?
Yes, that's the one. Yeah. But again, like Sandra said, you can't just go to the doctor and say, can you perform the anti-nuclear antibody test on me? You can't do that, right? Because that's just a test, but it's a combination of other things that they need to figure out first. And that's why sometimes it takes a long time to actually diagnose lupus.
All right, we have a comment here, but I'm just going to come back to you, Sunita. Let me just read it. Thank you for sharing your experience and raising awareness. Sorry, we are going through the pain. Okay, so we have that was a comment from somebody. And for those of you who are listening, if you want, you can definitely send your questions through the chat, or you raise your hand. I will definitely get you involved. If there's anything you want to shed light or just or ask questions, we would definitely like to have that from you. So this is another thing. The reason I asked that question of what should I ask my doctor, because I don't remember ever going into any clinic and seeing anything lupus written even on the wall or anywhere. So don't you think that it would be, they usually ask you, oh, you should tell me whether your family has a history of cancer, tell me this. And even you want to give a birth, they'll talk about sickle cell. But I don't think I've ever come across any of such information. Is there any clinic that you people know that they focus a bit on lupus?
Yes, Toronto Western, there's a number of clinics, but Toronto Western Hospital is the main center for lupus in Ontario. It's a clinic fully dedicated to treating lupus patients. Most of the research that goes on comes out of there. That's actually where my rheumatologists are and most of my specialists are, is at Toronto Western Hospital. Going back to the doctor's office. Now, one of the thing of doing awareness is, but a lot of doctors don't like to keep literature in their office because it gets messy and all that. We do have pamphlets and stuff with Lupus Ontario that we have, tried to send to different clinics and stuff, but it's not always guaranteed. And of course, unless you're at the Lupus clinic, they usually have those documents there, but you have to be at the Lupus clinic. So unfortunately, yes, when you walk in, highly unlikely you won't see anything about lupus. It's something that, again, like I said, in my 30 years, a lot more doctors are becoming aware of lupus. There are still ones who you might go in and they might be skeptical. Again, with lupus, it's so hard to diagnose at times that sometimes patients who should be diagnosed are kind of left behind hanging for years. Again, the factor that it mimics so many other diseases. And it's one of the unfortunate things that sometimes doctors themselves don't take the disease serious enough, because it mimics other diseases. 1 minute you're fine, the next minute you're not. Sometimes they don't have the explanations that, to help the patient realize what they're going through.
Okay, let us move away from patient's experience and the medical field and talk about Lupus Ontario. Can you tell us when Lupus Ontario was formed?
Okay, so Lupus Ontario was formed back in the 70s by a number of patients. And this is something I experienced myself. So one of the founding members was Honey Agard. And of course, when she was diagnosed in those days, there was absolutely hardly anything about lupus. They're talking to her and other people that was diagnosed in her era. They were just being told like they maybe have 5 years to live, and doctors didn't had any kind of treatment plans for them, didn't have anything like we do today. Sunita and I, we're very fortunate. But that comes from people like Honey Agard and Dr. Murray Uritz from the Toronto Western Hospital, who decide, you know what, something needs to be done about this thing called lupus. And so Honey and a number of other patients started a support group, which when I was diagnosed, 20 years later, it was that group that I actually ended up. And that's why I'm such an advocate, and my passion lies with support and education for lupus now, because when I was diagnosed, I know we had spoke about this earlier, but I'll just say quickly, when I was diagnosed, my family, my friends, nobody I knew, like 30 years ago, nobody knew anything about lupus. And there was hardly anything even in the libraries. You went into the library, there maybe was 1 or 2 books. So I was directed by Dr. Uritz, because that's who diagnosed me at the lupus clinic, to this support group. And that was, Honey and the others were forming. So Lupus Ontario kind of stems from that. That could be considered the founding of Lupus Ontario. Eventually it was Lupus Foundation of Ontario, and eventually it became Lupus Ontario. So in 2018, we celebrate over 40 years of Lupus Ontario doing the work that they are known for right now, which is helping those living with lupus, helping medical research by funding a data bank and a number of other things that they do with the fellows that work with Lupus Ontario, are funded through Lupus Ontario that works with the lupus clinic. So, so I would say from 1978, that's where it really started.
Okay. Sunita, let me just ask you a similar question. When did you find out about Lupus Ontario, and when did you become a member?
When I was diagnosed, my rheumatologist was actually the one who gave me the pamphlet and asked me to call, but of course it took me a while to actually call, because I'm thinking this is something that I wasn't familiar with. And I did some research, went on the Lupus Ontario website, and I was able to connect with one of the members, and she invited me. There was a support group in Mississauga. She invited me to join the support group, and I was amazed that it was just a combination of every age group. By then I was very young, so you're going through every scenario in your head, like what's going to happen now. But when I went there, I heard stories from different people, every single age group, and the support I got from there, I said, nah, I need to keep coming back. And I was able to get some of my lupus friends to come in to the support group, because when you're that young, you feel, okay, the world is ending. Who am I going to talk to? Who is going to understand what I'm going through? So once you meet people in your age group who actually understand what you're going through without actually explaining what you're going through, it's a great support. And I think Lupus Ontario is very good at that, to let you know that, listen, you are not alone. We can get through this.
All right, we have a comment. I'm just going to read it out. So there is, first of all, a correction. So it says, sorry for the pain you are going through. So that was a question. Or we are going back to the hospital situation again. I understand there is no cure, but what is the regular way of managing your condition, and how would you qualify the support you receive from the health system?
Okay, I am being very fortunate because, like I said, I was diagnosed at the lupus clinic and I've been treated at the lupus clinic. I do the support with Lupus Ontario. I'm the chairperson for the support committee. And I know not everybody has that experience with the medical community. Of course, being at the clinic, I'm getting the best treatment because that is all they do. When I'm experiencing the symptoms and I call my rheumatologist and I say I'm experiencing such and such, right away they know what to do. And my treatment is one of the best. So being a little bit biased, but I can honestly say that is not the same for everybody, because again, in the support groups, I do come across other members who the medical area is a huge challenge for them. If you're out of the main areas, sometimes getting rheumatologists is a challenge. So it's not always easy, but depending on where you are, that's going to make a difference as far as your treatment plan goes, as far as having access to the best care goes. Unfortunately, that's just reality, and that's the way life is.
Is it the same experience you have, Sunita? Are you also fortunate?
Well, I'll say no, because it took a while before I was diagnosed, and it took a special rheumatologist to actually say, listen, let's do this and figure it out. But yeah, it wasn't the same experience as Sandra. But right now, I have to say, when I make that call, absolutely, my family doctor knows exactly what to do. My rheumatologist knows exactly what to do, and they listen. So right now, absolutely, I am fortunate that I have a team of medical professionals around me who are able to, figure out what's going on. And my mom being a nurse as well, that is even a plus, because she knows exactly what to do. And yeah, but like Sandra said, not everybody's experience is that fortunate, because all of us come from different areas, right? And sometimes it's difficult to actually explain to your doctor exactly your symptoms and all that. So, yeah.
Okay, I'll come back to us talk a bit on Lupus Ontario, but I want to focus on the healthcare system, especially the Ontario healthcare system. We have a whole situation where nurses are complaining they are underpaid. The government says they don't have enough money to pay the nurses. Some hospitals are shutting down. How, after COVID, how is that affecting lupus patients?
Okay, well, of course, during COVID, all our appointments were done on there were phone appointments pretty well everywhere. Of course, having lupus, you're more at risk for infections. So many lupus patients wouldn't even think of going in person for an appointment at the height of the pandemic. Now I've returned back to in-person appointments. That's because I'm comfortable with that. But even now, there are some patients who will not go in because, again, they're at risk. You have a compromised immune system, so you're always going to be at risk. With the situation, for example, the emergency shutting down and stuff like that, that could be crucial, because if if you're one of those patients who are experiencing and need emergency care without a system there to assist you, your life could be at risk. So and with lupus as well, there's many medication. I'm just going to mention this quickly because cost for medication is a huge thing. And yes, if you're working for a company and you're fortunate to have a medical plan, you're very blessed. But if you're not working with a company that has a proper medical plan, you can have serious incur costs for medication. There is a Trillium Foundation that gives some assist, but right now I know there's been talk of having a plan that will include our medication. And for us, like, that's a fight that we need the government to get on, because there's some people with their lupus who can't even take the medication they're supposed to take because they can't afford it. So the medical system and the environment is not always friendly to those of us living with lupus in some cases.
So, Sunita, so the government doesn't cover like your medication treatment?
No, and that's one thing that Sandra was talking about, that you have to be fortunate and blessed to actually work for a company who has a good medical plan. And that's the number one thing that I always look for. Check the medical plan.
Yeah, so educate us on this one. This might be interesting to some of those listening and to me. Are they really, like, I will never get into any company and start thinking about, oh, let me look at my healthcare plan. What should I be looking there if I wanted to cover lupus?
Well, you have to look at the medication cost itself. It's really, it's expensive. I just saw a comment of someone talking about steroids. Absolutely. You need that to kind of cope with your immune system and the pain as well, the inflammation, right? So absolutely, steroid is one of it. And everybody's medication list is different from everybody else. So mine will be absolutely different from what Sandra's is. So absolutely, with any job that I apply for, I look for the like the medical benefits, like the cost of how much coverage are they covering, right? Some of them will have like 70% or 60. I go for 80 and above because I know somehow it's going to help me out a lot by the end of the month. And it's not like I'm taking just one, I'm taking a few, right? So I have to make sure that by the end of the month, at least they are covering 80% or 90%, I'm good, yeah. But no, the government does not cover the medications I take.
Okay.
Sorry about that. I was just going to say, a lot of people think everything is included in OHIP, and it's great that we have such a plan like OHIP. But until you have a medical condition, you don't realize that OHIP is great, and it's great. It covers your, your costs to visit doctors, you need surgery, and it's a wonderful plan. And this is why some of the government are fighting for this care, and not just even the medication, even dental, like stuff like that is not really covered. So it's a huge cost, and lupus medication can run you into the thousands of dollars on a monthly basis.
Okay, let me go to the comment. And so thank you very much, Sunita and Sandra, for sharing your experience with lupus and also educating us and creating awareness on this condition. My question to you both is, understanding that lupus attacks your health tissues in many parts of the body, are you placed on steroids to suppress your immune system, from overreacting? I think Sunita touched on that. Sandra, you might want to add.
Okay, so at this time, I'm in, I mentioned earlier, there's phases of lupus. So there's a phase where you're in a flare, whereas your disease is what we say active. That's when you could become very sick. And then there's a phase that they call remission, which is where the disease, because there's no cure for the disease. So you're not cured of lupus, but the disease become quite central. That means it sort of goes quiet. So you're not experiencing a lot of the symptoms, and you might not need as much medication. So for example, myself right now, I'm in what you call that remission state. So it's not that my disease is cured and I no longer have lupus. It just means I'm not experiencing the inflammation and some of the other symptoms of lupus at this time. Okay. I hope that helps.
Yeah.
Because like, again, the lupus is manifested in your bodies in many different ways.
Okay.
And you wanted to know about the steroids. Sorry. So yeah, when your disease is active, you will be on steroids and other, not just steroids, you'll be on other medication that will help to suppress the immune system for sure.
Okay, let us circle back to Lupus Ontario. Sunita, you made a statement that you are lupus friends. Are these lupus friends those who are non-lupus patients, or they are lupus patients who are your friends? So I'm trying to get to how does one become a member of Lupus Ontario?
Well, this is a good story because when I was diagnosed, it was actually, now we are friends. Like she's now like my sister because we're diagnosed the same day and we are in the same age group. She was in the bed right next to mine. So the morning she was diagnosed, that same afternoon I was diagnosed. So since then we became like great friends, and that's what I mean by I had to pull her to come to the support group because I thought it will help her more than us talking about what we are going through every single day, which is also a great support to actually have that friendship with someone who is actually going through what you are going through. But the support group was great. I think my mom also has been attending some of the support groups, even with meetings and stuff. I have some friends as well who've been able to attend some meetings. So it's a great way to ask few questions, and I'm doing my best to educate as many people as I can what lupus is, because I say, looking at me, you never know I have lupus until I actually come out and say I have lupus, and then all the questions come in, but, and I have to answer all those questions.
Okay. Sandra, how does what are the criteria to become a members of Lupus Ontario?
Well, to become a member, it's a free. You don't have to pay anything. All you do is you need to contact Lupus Ontario. You could go to lupusontario.org. There's information on how to reach the office. And if you'd like to become a member, online also is all our webinars that we have done. So those are available to you. And also, once you become a member, you could become part of any of the support groups. We have a number of support groups, which are very crucial to the operation of Lupus Ontario. That is one of the things we bill ourselves on, is the support we offer to the lupus community in general. So there's a number of support group. And yeah, it's very easy. You just contact the office, we'll get you set up. We have a monthly newsletter that goes out that you'll be able to get, so you'll know exactly what's coming up and what's happening. Of course, there's a number of events throughout the year. I'll just touch on this quickly. We have our walk for lupus. It's an annual walk. That's where we raise a lot of funds that does help to go towards research, as well as help with these support groups and other things that we do at Lupus Ontario. But yeah, membership is free. So if you're anyone that you know has lupus, or if you're a support, it's not just for people with lupus. If you're a caregiver, if you're a friend, you're welcome to become a member as well, because it is free. And you're also welcome to attend any of our support groups. And those support groups are listed on our website at lupusontario.org. We have monthly meetings. We have different age groups. We have, for example, the young adults social, and then we have a provincial one. We have some regional ones like in Durham and Ottawa. So yes, free. Anyone can join.
So, Sunita, so tell us some of the activities that Lupus Ontario run that non-lupus patients can take part in.
Like Sandra said, the Walk for Lupus is something that anyone can join and walk with somebody you know, or walk. I think this year they had it both. Well, I did mine in person, but it was mostly virtual. So it comes out once a year, and you can walk with somebody or in the name of somebody you know who has lupus, or just to spread awareness. Like Sandra said, you don't have to have lupus to be a member. Anyone can be a member of Lupus Ontario. And then some of the other activities that we just had, Sandra, was the volleyball tournament that it also helped us to raise awareness for lupus as well. So when you go to the Lupus Ontario website, you'll be able to see some upcoming events that if you're interested, absolutely join.
Okay. You wanted to say something, Sandra? Go ahead.
Yeah, we still, the year isn't over as yet, and we still have some webinars that are coming up. We have also a huge symposium that's coming up in October. We're gonna have a number of the lupus specialists will be there. So if anyone's interested to learn more about from the actual professionals, and then you'll get it from the doctor's perspective, unlike this one, which is from the personal perspective, because we don't give medical advice. Even at Lupus Ontario, we're not doctors, we do not give medical advice. So we have a symposium coming up in October that's gonna be amazing. And as well, there's other events. Because of COVID, we didn't have our Italian dinner dance this year, but we did have a fundraiser with the Italian dinner dance. So we had a live auction. There's a marathon coming up in later on as well. So there's a number of ways to get involved with Lupus Ontario. And again, all funds raised, you can donate all year round. All fund raised goes towards research. And it's lupus, another thing I'll just make a plug, is made up of volunteers. It is volunteers who's the heart of Lupus Ontario. So we're always welcoming you know, people who have different skill sets to join. And again, even if you don't have lupus, just to support and give back to your community.
Sunita, you are raising your hand about the marathon. You want to tell us more?
Yeah.
I know we wanted to keep this under an hour. And those who are listening, if you have any comment, please give it now, because I plan to round this up in the next 5 minutes.
Yeah, what I wanted to say, the reason I was happy about that is because I'm glad it's back in person, because I've been doing that marathon for the past, I think 6 years now. So I'm always looking forward to it. I always have to put on my Lupus Ontario shirt and I'm right there. So no, I was excited because I know it's coming up. Yeah. Okay. But it's a great, like Sandra said, if you want to run, walk, whatever, it's a great opportunity to join the team and join the marathon.
All right, my last question before I close. I'll start with Sandra. People of African heritage community, we always deal with stigma, and there's always stigma for everything that you can think of. What are some of the stigmas that you've experienced or that is you've heard about lupus?
Okay, so and I think one of the biggest thing is you don't look sick. So with lupus, again, being the disease of 1,000 faces and going through periods of flare and remissions, and again, just like Sunita says, just looking at us, how do you tell someone has lupus? Really, you can't. But a lot of times when, even in the workplace, when you say you have lupus, people will look at you, right? And it's like, well, you were here yesterday and you were fine. So why aren't you here today? Because you have now called, you know, yesterday you were fine and you were fine at work, but today you get up and you can't get out of bed, so you need to call in sick. So I think work is one of the hardest place to deal with having lupus. It's a bit of a challenge to deal with, you know, trying to let people get a better understanding of what lupus is and how it affects you. So I think that is one of, and has been one of the biggest challenges, I think. Also medication. Unfortunately, when you're on medication, it does terrible things to you. There's huge side effects. And so for example, with prednisone, most lupus patients has to take prednisone once or sometime in their lifetime. And, you know, you gain weight and, you know, people, oh, you know, they might attribute to that you, maybe you're not watching what you eat or anything, but it has nothing to do with that. It's the disease. And in some cases, the medication you're taking. So just a couple of challenges. I'll mention those, maybe Sunita maybe want to share others. But having, I think the biggest one is definitely in the workplace.
Absolutely, Sandra, you're right. I think what it took me a long time to actually come clean, I'll say, with my boss or my former bosses that I was sick, and I had to explain exactly what that looks like. But with my new job right now, from the get-go, my interview, I had to let them know that, listen, this is what I have. I'm not going to let it affect my job. Some days I may not be able to make it to work, and I'll let you know. I'm very honest, but please don't take this as something that is going to affect my work. From then on, they know when I call in sick, they know I'm really sick. On some days, I push through. I work from home on some days, which they are very, very supportive with that. And I have to say, I'm blessed right now because my boss, she understands. She is like my number one supporter, one of my number one supporters, where if I'm not feeling well, she'll text me privately and say, are you okay? Is there anything we can do? Do you want to work from home today? Like all those little questions. And then you have the stigma, of course, of you don't look sick, which that comes most from my families. And when I was diagnosed, one of the things I had to struggle with was the friendships I had. Like Sandra said, sometimes you have to cancel plans, and to explain why you are canceling plans when you're like 25, like what's wrong with you? Why can't you go out at 8 p.m.? Well, 8 p.m. is like my bedtime, but why are you going to bed early? What's wrong with you? You were fine this morning. I saw you this morning. Now you can't go out. So I'm still dealing with those now, but it's okay. I have really close friends and family members who completely understand, and it's okay right now, but there's still a stigma around it.
Okay. Yeah, well, definitely. I know I promised at some point that we'll talk about the stress and the environmental factors. Unfortunately, we don't have time for that. We have one question, and please be as brief as possible. We just want to respect the audience and the person who asked the question. It's on the comments, so I'm just going to read it. Thank you both for sharing your experience. I have two questions. Question number one, can someone get healed completely from lupus, or it is for life? Question number two, is lupus more common with men or both men and women? And I'll add there, is it also related to a race? So let Sunita answer question number one. Can someone get healed?
Sorry, there's no cure for lupus. You can only be either on remission, like Sandra said, where the symptoms might not be there, but it's just you still have lupus. So there's no cure. That's why there's still research being done about that. And yeah, you have lupus for life until somebody came up with a cure and say, oh, we found a cure. But you know, there are medications out there that in the past have been promising, but because everyone's lupus is different, you can't just go and say, oh, I'll take that medication, right?
Okay.
But maybe that's not how your lupus works, and that's not what's going to help your lupus by taking that medication.
All right, Sandra, is lupus more common with men, women, both? Is it race related?
Okay, so lupus is mainly affect women of childbearing years, and so we think it could be related hormonal wise in a way, but since a number of years now, and with more research, we're seeing more men as well as children getting lupus. People of African descent is more affected, and Mediterranean and some of the South Asian country, I would say. But in general, anybody can get lupus. There's a high percentage of Caucasians also who has lupus. So you're not exempt by race per se, but predominantly it might affect more people of African descent.
All right. Thank you so much. I really, really do appreciate you taking the time to come out. I know some of you or both of you are supposed to be sleeping now. I hope I've not put you in an environment and stress that you have a crisis after this. Again, to everybody who was the audience, thank you for participating. Thank you, Vivian. Thank you, Peggy. Thank you, Mafwa, Godliness, Bob Dinger, Anna, and every other person who was here before. Usually at the end, I ask everybody if you can turn on your microphones as well as your videos and tell Those who are on the panel, thank you. That will be much appreciated. So anybody wants to, you can just shout. You don't really need to be called upon. So you're free to turn on your microphones and just say hi.
Well, I just want to say very quickly before you go, I just want to thank you for having this session tonight. Anything to bring awareness to the lupus community is greatly appreciated. So hopefully your audience will be able to appreciate this. And I just want to mention one thing. We do have a support email. So if you or anyone that you know has lupus and has any specific question, they can email or contact Lupus Ontario for more information. We're always available at Lupus Ontario, so please reach out to us. And thank you again for providing this platform to bring awareness to lupus.
Well, I think we have to thank you, and I know you people need a lot of support. So I'm going to be pushing for everybody that I know to at least have a look at the website, lupusontario.org. Please make sure you check out the website. And if you have any questions, you can get back to me, and I definitely can reach out to Sandra and Sunita and other members of Lupus Ontario. Hopefully, we're going to get more people who will listen to this talk, and then they'll take the message out there and continue with the support and funding. If there's anything at any time that you want us on Perspective Nation to know or to share, don't hesitate, just send us an email. I will definitely do that. Again, thanks everybody for joining us tonight. It's been a pleasure having Sandra and Sunita. Good night.
Thank you.